Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Brumell.
Good afternoon, and thank you for joining us again for American Medicine Today. I'm Kimberly Brumell. We have executive producer of AM Tampa Bay, Ethan Euchre, with us.
Good afternoon.
Our TV and radio senior fellow, Jeff Wagstaff.
Good day.
And, of course, world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute. Thank you for being here.
Good afternoon.
Good afternoon. We are constantly, week after week, talking to patients that have made miraculous recoveries through the Bonati Spine Institute and the usage of the Bonati Spine procedures. And we always talk about how Bonati succeeds where others fail. And it's true. Week after week, we hear from the patients talking about how they were told they're going to remain the same, that there was no hope, there's nothing they can do. The pain meds that they're on, they're going to have to exist on forever. It's not the case. There is a place that can help. There's a lot of imitators out there that claim to do what we do, and in fact, they have not had the success. And again, we tend to fix the failures that people have had. And we're finding out now that some have reverted back to using the invasive methods of screws and plates. And in today's day and age, you want to make sure you're doing the right thing. So check everything out, and you want to do it right the first time. So the Bonati Spine Institute, we have over 98.75 immediate success with those procedures. So do it right the first time.
What are you laughing at over there, Jeff?
You know, I would need, if I had back problems, I would need a plate and a screw in my back about as much as I would need a hole in my head.
Exactly.
I just don't understand what could possess a qualified physician to implant those devices in someone's spine or their neck.
Or to fuse vertebrates together.
Well,
That's craziness.
The thing that gets to me is a lot of the time, and not so with the Bonati Spine Institute, when we talk success, we mean true patient pain resolve. A lot of these other places are just saying, hey, I performed a surgery. And you heard last week about a patient that talked about getting some information from them about what could be done. And that particular doctor talking highly invasive, 6-inch scar
on his neck, wanted to put a cadaver bone in his neck.
All different things, but highly invasive nature of it. And when he said, what is my mobility going to be like? It's going to be exactly the same as you are right now.
You know, we've done the show now for a number of months.
Yes.
We've talked to 15, 20 patients.
At least.
And truth be told, if I was driving in my car listening to the show right now and heard Kimberly talking about the lady who came to the Bonati Spine Institute in a wheelchair, had 3 procedures and walked out, you have to stop and what? But we've seen it time after time after time again, how people come with very poor quality of life, very high pain, very little mobility, and yet Dr. Bonati and his team give them back a quality of life. It's pretty amazing.
They get it done. That's what he does.
And on today's show, on that point, we have Brain Awareness Month. I don't know if you all are aware, but on today's show, we have Dr. Randy Kahn, and they're going to tell us more about how age is not a factor when it comes to your brain health. So that's good news. And then we're going to hear more about what's new in American medicine today with Dr. Bonati. But up first, we have an absolutely incredible Back to Life segment. And joining us from Tennessee, we have Lamar and Jane McDaniel on the phone. So thank you to the both of you for being here with us. And both Jane and Lamar, why don't you kind of walk us through the process? Now, let me preface this by saying Jane McDaniel was the patient of the Bonati Spine Institute, and Lamar was a caregiver for not only her, but a multitude of other people. So why don't you kind of tell us your story? How did you end up in pain, Jane?
Okay, it started with osteoarthritis. I was seeing my rheumatologist, and it just progressively had gotten worse and worse and worse. So he had sent me to an orthopedic surgeon to get a second opinion.
Okay.
And after that, they had told me that the orthopedic surgeon had gone through all of the process of what it would take to fix my back with I had the osteoarthritis, I had the scoliosis, I had spinal stenosis, and I had protruding discs. And after he went through all of his presentation with the cages and the screws and the bolts and all this, I was very hesitant to even talk with him about it because I knew what it would take to go through all that, because he had told me it would take me to a year and a half to recover after that type of surgery.
So I can understand why you would seek out an alternative. How did you find Dr. Bonati and the Bonati Spine Institute?
A friend of ours had been down and Dr. Bonati had done surgery for him. And they were doing a seminar here in Chattanooga, and he had called and encouraged us to attend, and we did. And we're very impressed by the presentation that they gave. So I, in turn, sent my MRI down for them to evaluate and see if they could help me in any way.
Jane, can I stop you for just a moment? Can you tell us how you were limited before coming to the Bonati Spine Institute? What was your life like?
Yeah, how severe was the pain, and how did it affect your life?
Well, I was in a wheelchair. I was totally incapacitated. There just wasn't anything I could do. The only way I could get around was in that chair. I couldn't stand on my feet any time at all.
So Jane, even when you were at home, maybe after an evening meal or watching television or have to go down the hall to the restroom, you were using that chair everywhere, not just to go out, but all the time.
All the time.
How long were you wheelchair bound?
I'm sorry.
Can I ask how long you were wheelchair bound?
Approximately 6 months.
Wow.
And did all of these symptoms develop for a reason, or just sort of through time, genetics, age? Was there a reason that you started experiencing these problems, Jane?
I'm sorry, can we stop just a minute? My cat is down here, and he's making terrible
I
noise.
was wondering
well,
what
maybe
that noise was.
Lamar,
Sounded like he wanted to chill in.
Lamar, are you still on the phone? Sir?
Lamar, are you there?
Lamar?
I'm here. Yes.
Okay. Maybe you can fill in. During... Ooh.
Whoops, hold on.
Uh-oh.
We're getting feedback.
Oops,
Hold on.
sorry. Okay. That's okay.
Go ahead now.
Oh, okay. Why don't you tell us kind of what life was like from the perspective of being a husband? You know, just how was your life affected while she was in the wheelchair?
Well, our normal life was totally abnormal. We could not do anything, could not go anywhere. Everything was based around her pain, which was constant and wouldn't go away. And my job was carrying ice packs and trying to get her comfortable.
Right.
And our whole life was centered around the pain that it was in, the discomfort she was in.
You know, Lamar, that I really feel for you, because as you were talking, it sounds like your wife was a prisoner to that pain.
Oh, yeah, she was, and in turn I was too.
Yeah, but
Right.
you were perfectly healthy, so that really had to affect your psyche and just your day-to-day outlook. I mean, it must have been tough taking care of somebody in that much pain.
It just wasn't just during the day; it was all night too. And it was just that was it for both of us.
Well,
So once you guys made your way down here to Hudson to the Bonati Spine Institute, kind of walk us through what happened. You know, how were you greeted? How was the feeling? Were you guys anxious walking in there, or because you were referred by someone else who had a successful procedure, was there not a whole lot of anxiety? You were just anticipating success. Take us through all that.
Okay, well, we first of all, as a caregiver, the patient is in so much pain that they just mentally are not able to deal with a lot of things. And so as a caregiver, I asked for references from Bonati, of people who had had previous back surgery. I had about 50 people I called and asked them about Bonati, and then we had this friend who had surgery there, in, I think about 2004, and he was doing extremely well. But as we came, I have to tell you, we became very skeptical. When we walked in that door, your first thing's going through your mind, is this the right move? Because this is for the rest of your life decision.
Sure.
That's being made. If you have surgery the traditional way or that, either one, when you're talking about back surgery. So, but we were, a lot of anxiety went away because of the way the people treated us when we came in, and we immediately felt much more comfortable, and everybody treated us like a customer, I guess, instead of a patient, and everything was based around our needs, and so it made it a lot easier for us. And as we went through the testing procedures, we realized that we were probably in the right place. But probably the most comforting thing, I guess, was when we met with Dr. Bonati, and he, first thing he did was get me by the hand and my wife by the hand, and he said, "I'm Dr. Bonati, and I'm here to help you." And he said in a way that you kind of believed that, and so that helped a lot. And then as we got into the first procedure, we immediately saw results from that, and second, we immediately saw results from that, and so that's kind of how it went when we began.
Now, how quickly after the surgeries, how is your wife now? I mean, is she mobile? Is she still in the wheelchair?
Well, and again, let's back up. If people are just joining us, what happened is Jane was she was wheelchair bound, couldn't really do anything, came down from Chattanooga, Tennessee, saw Dr. Bonati, had a procedure performed, and as Kimberly said, take us to now. How's she doing? Is she still in a wheelchair? How's she feeling?
Now, she takes me shopping and wears me out.
As a good wife should. Right. But she's not in a wheelchair, correct?
No, she's not in a wheelchair. No.
Look at that.
No, we go shopping. We go to the Walmart, and I'm ready to leave, and she's still shopping, and she's walking. And so we went back to see the rheumatologist after we finished the procedures that they did at Bonati, who was a very good friend of mine, and he was absolutely amazed that she walked in his office, for one thing.
Wow.
Can you hear the smile on his voice? Can you hear the smile on his voice talking about his wife taking him to Walmart and wearing him out?
Let me ask you this, because when you were in the wheelchair and then you started going through the surgeries,
let's do this. Let's do this, Kimberly. We're up against a break. Can you guys hang out for a few minutes, and we'll talk to you on the back side of the break?
Okay.
All right,
perfect. Thank you.
All right.
You're listening to American Medicine Today on News Radio 970 WFLA. After the break, you're going to be hearing more from Jane and Lamar McDaniel on their amazing recovery after the Bonati spine procedures. You're listening to News Radio 970 WFLA. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. The Bonati Spine Institute is proud to announce more than a 94% patient-reported success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit us at bonati.com.
All my pain is gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. It gave me my life back.
It's just wonderful.
I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.